Once you've determined your enrollment targets, screen fail rate, and identified similar studies you can reference, you're ready to find your participants. It's important to understand that most recruitment methods have a low yield, and it's best to choose several strategies to help increase your chance of success. Because you'll want to monitor and adjust your recruitment efforts and resources based on what's working, you should include multiple strategies in your IRB protocol to prevent having to submit an extra modification midway through recruitment. First, we'll start with strategies that are relatively easy to execute. If you are unsure of what recruitment methods to choose, or if you have a limited budget, you may want to start with methods that have a low barrier to entry. Some of the recruitment methods that are easy to implement include utilizing chart review, creating recruitment flyers, national registries such as Research Match, and free advertising such as Craigslist. Keep in mind that while these methods may be low cost in terms of expense, they can require a significant effort from the research team to execute. Next, we'll look at two methods that require some planning, but are effective at targeting potentially eligible participants. If you have a cohort that can be identified with data in the electronic health record, you may wish to use this as a resource for recruitment. This method requires some advanced planning to allow for time for the data extraction, but it can be one of the most time and cost-efficient recruitment methods. Another way to target participants is through social media. Social media can work for recruitment campaigns that target a very specific demographic, or those who are likely to self-identify online as being impacted by a condition. This method can be efficient and cost-effective, but if your study team is new to social media recruitment, it can have a learning curve. Additionally, you'll need to monitor progress and adjust your strategy to ensure success. You can learn more about recruiting patients through the electronic medical record and social media at recruit.ucsf.edu. If you have a larger budget and need to recruit larger cohorts, you may want to consider adding some of the larger media campaigns such as television and radio ads and even print ads. These can be costly to set up, but for large-scale recruitment campaigns, they can be an essential method of contacting large groups of people. It's important to keep in mind that certain populations require extra consideration. First, remember that the patient may not always be your target audience. For example, pediatric studies typically target parents, caregivers, or their providers. Therefore, it is important to understand that studies can target patients, parents, caregivers, providers, and the community. Second, if you're targeting specific demographics, you will want to make sure that you are using recruitment methods that will reach those populations and are culturally appropriate. If you are unsure of how to approach this, consult a colleague or request a recruitment consultation. Now that you have identified your study population and have determined your recruitment methods, you're ready to get started on our next video, Developing a Recruitment Budget.